I'm Kathleen Morris with the Canadian Institute for Health Information, and I'm the Vice President of Research and Analysis there. In November, we released a report called Trends in Healthcare Inequalities, and it showed some very interesting results about the difference in health and health outcomes between rich and poor Canadians. Our report wanted to determine whether things were getting better or worse in terms of the gap in health and health outcomes between rich and poor Canadians. What we did is we took all Canadians and categorized them into one of 5 income groups, ranging from the highest to the lowest. Then we looked back over a 5 to 10 year period to see how they performed by income group on different measures. Some of them were about health, some of them were about health behaviors like smoking and drinking, and some of the measures were about things that we know are important to health, like good nutrition and safe housing. So what our study looked at was whether the gap in health and health outcomes between rich and poor Canadians was getting narrower over time. That's something that Canada had committed to as part of the 2011 international agreement to reduce inequalities in health. We measured 16 indicators, and what we found for at least 3/4 of them, there was no change in the gap between rich and poor over the last 10 years. In fact, for 3 of the indicators, the gap between rich and poor Canadians was actually getting worse. For example, one of the areas where the gap was increasing was for smoking rates. So while we know that in our lifetimes, smoking rates in Canada have reduced dramatically, most of that gain has happened for richer Canadians, and the smoking rates of people in the poorest income group are about the same as they were 10 years ago. So I think it's important for us as Canadians to understand that there really is a gap in health and health outcomes between those of us with a good income and those of us who are poorer. There are many messages for governments to take away from this as well. There's ways for governments to target some of the programs, such as quit smoking programs, to the specific needs of people in the poorest income group. There's things for us to think about as a society around having access to healthy foods at an affordable price, about living in safe and walkable neighborhoods. Those are things that matter in terms of health. There's also questions about really, do we need to look at addressing a basic income for people so that they can live a healthy life? So I think the report provides interesting data, but it also raises a lot of questions for us to think about as a country.